I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today I'm here with Kathy Raethel, former president of Adventist Health Castle. Welcome.
Thank you. Aloha.
Well, tell me a little bit about how you got started in the medical field and with long-term care.
Yeah, it's an interesting story. When I was 16 years old, I wanted to get a job like most 16-year-olds, and I applied for a job at a local nursing home as a nursing assistant to work part-time while I was in school. Most 16-year-olds don't do that. And as I look back at my life, I think there were two triggering factors. I had my tonsils out when I was 4 years old, and it was a fairly traumatic experience, as you can imagine. But there was this wonderful nun who took care of me. I call her, even to this day, my blue nun. And it made a terrifying experience actually quite lovely because of my memories of her. And then before I turned 16, I had my appendix out at the local hospital. And I fell in love with what those nurses were doing. So when it was time to get a job, I thought, well, maybe I'll try my hand at nursing. And so I was given this nursing assistant position in a long-term care facility. And it really, I think, inspired much of my life in terms of the caring and compassion that I learned there.
As I talk to people about their stories about how they enter the industry, the personal connections are always so strong. It's really amazing to hear those stories. Well, in 2019, you led Adventist Hospital in Hawaii to earn the Malcolm Baldridge National Quality Award, the nation's highest honor for performance excellence. Tell us about that journey and what the award meant for you and your facility.
Right. Well, the journey, of course, started long before I entered the halls of Adventist Health Castle. I was recruited there in the year 2000. But if you back up to the 1980s, I think is when they started their journey of excellence. All of us went through customer service training in the 80s, management by wandering around in the 90s, those kind of things. But all of that created the building blocks for the Malcolm Baldridge Award. When I got there in 2000, there was a gentleman who'd already been working there for 20 years. And he came and met with me the first week I was there and asked me, have you heard of the Malcolm Baldridge National Quality Award? I was embarrassed to say I hadn't. And he said, I think we should pursue that. And he was obviously very enthusiastic. And so we did. And of course, about 18 years later, we achieved that pinnacle of receiving the National Quality Award.
I like how it's described as a journey, because truly there were a lot of years of work put towards that goal.
Right.
Well, you frequently speak to audiences, and one of your topics is why love matters.
Right.
So how does that guiding philosophy relate to the long-term care industry?
You know, for us, it was about identifying our core competencies. What are the things that make you who you are? We were great at strategy in terms of executing strategy. We were great at chasing zero harm. We were passionate about that. But one day we were talking about, are those our core competencies? And my chief nurse at the time said, she lifted her head, I'll remember this day, and she said, oh, it's because love really matters here. And for us, it was the glue. It was the glue to the work, that we really care about one another, that we care about our community. We even cared about our physicians. And so we kind of took that phrase of love matters here and really disseminated that throughout the organization, even though it was already there.
What a great way to distill all of that caring and compassion just into that perfect sound bite. Well, how can those working in the long-term care industry find inspiration and take that back to their workplaces to stay fresh and engaged?
Right. When I first started in long-term care, way back when I was 16 years old, one of the things that I learned very quickly was that our elders have wonderful life stories to tell us. And it's easy to connect with them once we start to listen. And, you know, as I finished my 2 years there and entered nursing school, I had this great leg up on everybody else because I had learned that patients are real people and that they have real lives and there are families who just care so very much for them. And I think for me, that's what's easy about the care that we deliver, is these are real people. They're real mothers, real fathers. They have real children, and they're very much loved.
Absolutely. That that personal connection again. Do you think people have the right idea about the long-term care industry? Do you think it's a little misunderstood? How can we change people's perceptions to understand this deep connection and compassion and care?
I think if COVID taught us anything, it's that the long-term care industry, I hate to use that word, but the long-term care providers are so essential in our communities, and that the work that they do is vital. We learned that the hard way, of course, through COVID, through the news stories. But I think we have to tell our stories. One of the things I do when I speak is I tell a lot of stories. I don't think it's about facts and figures. I think it's about the people who work in long-term care, the people who receive the care. It's really about telling our stories and letting people know what we do.
Absolutely. Could not agree more. Well, thank you for spending some time with us today.
Thank you.